Hello, my name is Craig Prince, and I'm here today to talk to you about the changes in Medicare prescription drugs and how it will affect you. And what I'd like to do for a moment is simply talk about a legislation that had taken place and the timeline over which these changes have taken place and how it's going to affect you. So let's go. So these changes in Medicare came about as a result of the Inflation Reduction Act that was passed as legislation in 2022. And basically how it affects Medicare prescription drugs is in 2023, it put a cap on insulin copays. So insulin drugs would no longer have as high of copays, if you will. Most of them were capped at $35 copay. And then also what it did was it put a $0 copay on most vaccines. As an example, if a person wanted to get the shingles vaccine, which is a very expensive vaccine, before it might have cost a couple of $100s to do that. And as a result of that legislation in 2023, it put a $0 copay on those costs so that people, seniors, if you will, like myself, would go and get these vaccines. In 2024, it kicked in a $0 cost in catastrophic coverage. I'll go over the 2024 benefits here in just a moment, but that was big because in 2023, if I hit the catastrophic stage of Medicare prescription drugs, I would either pay 5% of the cost of the drug or a stated copay for generic or brand names. And the copay would be whichever was larger, the 5% or the copay. And then it also expanded the Extra Help program, what we call the Medicare Prescription Drug Extra Help. In 2025, this is where its redesign is going to affect Medicare prescription drugs, and it will affect, the cost and the benefits structure, and we'll talk about that. And of course, this timeline for Medicare in Medicare 2026, drugs like the ones that are listed here will now no longer will be negotiated by the insurance carriers with the pharmaceutical companies. But the pharmaceutical companies will have negotiations through the federal government, through the Medicare program, to get the costs of these medications reduced. All right? So let's talk about what the Medicare prescription drug plan looks like in 2024, and let's look at what the changes are for 2025. So as you can see on this side, currently, a Medicare prescription drug plan, whether it's a standalone or within the Medicare Advantage prescription drug program, can have anywhere from a $0 deductible up to a maximum of $545 deductible. When a person goes from the deductible stage into the initial coverage stage, the insurance companies can establish copays for whatever tier of drug that you have, whether it's preferred generic, preferred brand, non-preferred brand, or specialty drugs. The copays or coinsurances can be set up by the insurance companies, but what they do want is, on the average, the insurance companies paying 75% or more of the cost of the drugs, while the consumer pays 25% or less of the cost of the drugs. And a person will stay in that initial coverage stage until they have hit what we call this $5,030 initial coverage limit. So if you can think of it this way, if you're taking a drug and that drug has a retail cost of $500, I will know, and if that was the only drug I was on, I would know that around the 11th month that I would reach that initial coverage limit. And then if I went into the coverage gap stage, also known as the donut hole of Medicare prescriptions, the pharmaceutical companies under the Affordable Care Act were required to reduce the cost of their drug by 75%. So I would only be responsible for paying 25% of the cost of prescriptions while in the coverage gap. And I would stay in the coverage gap until the total out-of-pocket that I've incurred from the deductible all the way up to this $8,000. Once I hit that $8,000 out-of-pocket maximum, then in 2024, as indicated before, my cost would be zero because the insurance companies would be paying all the cost of the drugs. Okay? Let's look at the other side of the equation for 2025. And in 2025, what we see is that the deductible is going to be $590. Okay? Once I've satisfied that deductible, whether it's zero or any amount between that and $590, I'm going to enter the initial coverage stage. Okay? And you'll notice that there's only an initial coverage stage under the 2025 rule. And it says the 2020 or 25% coinsurance. What it's stating here is the insurance companies can establish a copay, meaning a specific dollar amount, or a coinsurance, meaning a specific percentage amount. But on the average, Medicare set it up so that the insurance company is paying 75% or more of the cost of drugs. Okay? And then I'm going to pay my share of the costs according to the copays or coinsurance that's on the plan until I hit $2,000 out-of-pocket maximum. So before my out-of-pocket maximum was $8,000, now it's going to be $2,000, and then the insurance company is going to be required to pay 100% of the cost of the drug thereafter. Okay? That's good news, right? Well, it's both good news and it could be bad news. Okay? And the reason I say that, and I'm going to go to the next screen, is because if, as an example, and let's just take it out of health insurance and let's just talk about auto insurance for a second. If I had a $500 deductible for comp and collision on auto insurance and the state government came out and said, you can't do that. The highest deductible that can be had would be a $100 deductible. I would know from reason that if I'm going to be mandated for the insurance companies to pay everything after that $100 deductible, that I'm going to be paying more for the cost of my auto insurance. Okay, so in the same respect, if the insurance companies are mandating that my worst case scenario is going to be $2,000 of prescription cost out of my pocket, where before it was $8,000, the cost of the prescription drug plan is going to go up. Now, this is going to be highly beneficial to people who are taking very expensive drugs. Okay, I've got clients that are currently taking medications that are $5,000, $6,000, $7,000 per month. This is really going to benefit them. Okay, so, and again, going over the 2025 plan, I'm going to have a deductible where I'm going to pay 100% of the cost of the drugs, whatever the deductible is. It can be anywhere from $0 up to $590. Once I hit that deductible, if I'm required to pay a deductible, then the insurance company is going to establish copays, specific dollar amount, or coinsurance specific prescription amount, percentage amount, and I will pay. They're going to be required to pay on the average 75% or more of the people's cost of the drugs, or saying that in reverse, my worst case scenario should be around 25% of the cost of the drugs until I've reached $2,000 out of my pocket. And of course, they add everything into that. Anything I've had to pay, whether it's deductible, co-pays, co-insurance, whatever it is, when it hits $2,000 out of pocket, then the insurance company is paying 100% of the cost. My copay is going to be zero. Okay? So hopefully unbundling the previous screen and showing you just simply what 2025 is going to look like will be helpful for you. All right? On the next screen. One of the other benefits that occurred under this plan, under this legislation, was the creation of the Medicare Prescription Payment Plan. And basically, this plan was designed to take away the shock from low-income Medicare beneficiaries and take what might be a potential up to $2,000 cost shock and spread it out over a year for the consumer to pay. Now, this benefit will be administered by the insurance carrier for the Medicare prescription plan. Okay? So whether that's a standalone plan, because I'm utilizing Medicare as my primary coverage and picking up Medicare supplement and purchasing a standalone prescription drug plan, or whether I'm on a Medicare Advantage prescription. So this, again, the Medicare Prescription Payment Plan, M3P, was really designed for low-income members who do not qualify for the extra help or reduced low drug costs through any other program, or they're not on any state program. They're the ones that are going to be likely to benefit. And my good friends over at SCAN basically said, as they viewed it, if my consumer has prescription drug costs that are over $600 per month, okay, that prescription, if I had that and I was having a high copay, I may have to pay, $2,000 out of my pocket over the first 2 or 3 months. It would allow that to be spread out over the entire year. And of course, understand that the insurance company would be billing that throughout the entire year. I'm to understand that if I go more than 2 months and I don't make that payment under my Medicare prescription payment plan, that then the insurance company would stop that. I would then be responsible for whatever is required to be paid under the plan and no longer receive the benefit of being able to spread my payments out over time. All right? So hopefully you understand what the Medicare Prescription Payment Plan, the M3P, is going to be for paying my prescription drugs in 2025. So the conclusion that I'm going to talk to you about is any government mandate is going to raise costs. All right? Like I said, it's a two-edged sword. It could benefit you. It might benefit you. It might not benefit you. And understand that the insurance companies, if they're required to pay more out sooner, then they're going to have to adjust their plans. All right? So if you're currently on no medications or on low-cost generic drugs, I can just tell you up front, changes are probably not going to affect you. But I say currently because, I'm on Medicare also. I'm taking some low-cost drugs now. Things could change. And so understanding that is going to make you want to look at this from year to year, especially if you have changes in your prescription drugs. So changes in prescription drug coverage, whether standalone or on a Medicare Advantage prescription drug plan, probably is going to result in some of the following possibilities. Whereas most plans, I would tell you a lot of plans have no deductible on their Medicare Advantage prescription drug plans. We may see that changing. What we may see is more plans with deductibles. And those deductibles may apply to all prescription tiers, or they may apply only to the brand name tiers. And we've seen some of that already on some of the standalone Medicare prescription drug plans. What we might see is higher copays on the various tiers outside of the mandated costs that Medicare's already designed out. And we could see drugs moving to a higher tier. So I may right now have a drug that is an expensive generic drug that's being covered under Tier 2 that they may move to a Tier 3. All right? So that could be a way that the insurance companies could mitigate costs and keep plans solvent. Okay? And then there could be a reduction in the drugs offered in the formulary. When the Medicare Prescription Drug Plan Act was first passed, basically what it mandated is that if there were 2 generics and 2 brand name drugs in a particular medical malady, the insurance companies were required to have at least 4 drugs, 2 generics and 2 brand name drugs. Okay, and so what we see is one of the things that we can look at and see that some plans have a lot of of drugs for a therapeutic classification. As an example, high blood pressure, that's considered a therapeutic classification. They're only required to have 4 drugs, 2 generics and 2 brands. And most plans have significantly more than that, but we may see a paring down of what's being offered as a way to mitigate costs for the for the insurance company, so they can move you on, if you will. They're not playing doctor, but they're just trying to keep solvent under their plans. We could see a reduction, like I said, a reduction, and then we could see increased premiums. And Medicare, I think, anticipated, or the legislation anticipated this. So plans that are currently out there have a cap on how much they can increase in premiums. But one of the things, and again, this is conjecture by Craig Prince, but one of the things I think may come out is they may come out with other prescription drug plans, and so they may, on the ones that they don't have the flexibility of raising premium on, do formulary adjustments, adjustments to the drugs that are covered in the plan that they have, and maybe offering other plans that have higher premiums that would allow them to be solvent and also give choices that the consumer may want. All right? So, what should you do? The first thing we would tell you is you should run drugs through the Medicare website to see which prescription drug plan or which Medicare Advantage plan will provide you with the best coverage for your drug annually. And as I talk about that in that prescription drug, or going over the Medicare.gov website and how to look at that, when we do that, that's only going to take into consideration the drugs. It will never take into consideration whether or not the particular plan that you're looking at, whether it's high on the list, is going to have your doctors and the hospitals you want on the plan. So that's certainly something to keep in mind. And then understand that your plan, you need to understand your plan, and not only the prescription drugs that are on your plan, but you should understand your complete plan so that you get the best opportunity to utilize your benefits in the best way necessary. I had a person come in recently who's on a plan. We're not changing the plan, but I explained the plan to the consumer, and they said, "Craig, you have explained this much better than the current broker that we have. I understand now the benefits that I didn't even realize that I really have." So it's important that you understand your benefits so you can get the best value and put yourself in the best scenario to be as healthy as you possibly can. We would ask you to utilize us to help you and your friends. We've been assisting people for over 47 years with their Medicare knowledge and being able to find plans that are right for them. And we believe in personal customer service with our end goal to help make what seems complex easier to understand. And remember that CAP means caring about people. So I would suggest that if you want that Medicare, how to understand what plan's right for you at Medicare.gov, that you request a link that we send you that YouTube video. And feel free to call us anytime with any of your questions, with any of your referrals, with anything that you're thinking about at area code 909-590-4405. And you can leave a message either in extension 101 or 102. Okay, that's 909-590-4405, extension 101 or 102. And we'll be here to help you with any questions that you have. We look forward to being of service to a continued service to those of you who are our clients, and look forward to being of service to anybody who might want to find out more through CAP Insurance Services based on this information. Thank you so much.